right, let's get into it. We're going to talk about the eval today, which now all of you, most of you, I don't know about the pitching guys, but, and girls, I don't know if you've been in on evals, but that's what we're going over today. All right, so first, I wanted to talk about, if we don't know basic anatomy, it's going to be really hard to understand what's going on. Obviously, like you guys have seen, super detail oriented. Understanding the compensations and why they're happening is key. So first resource, and I'm going to send you guys to this presentation so you'll have access to all of this. Highly recommend getting some sort of book to start learning anatomy and starting to understand insertions, organs, everything like that, how everything kind of moves. So this is on there for you guys to reference back to start kind of getting a good idea on that front. Okay, let's jump into it. All right, so key, and I think Andrew has said this before to you guys, but understanding what is optimal and what's dysfunctional is key. So understanding dysfunction, that's kind of like what we see all the time, right? We kind of see people who have dysfunction and we're kind of correcting them. Work. Well, we're kind of seeing dysfunction and we're correcting them. But it's hard to understand what's dysfunction without knowing what's optimal. Okay, so this is part of what's optimal, understanding optimal posture. We've seen a lot of this. So this is normal. This is a little bit of a lordotic curve, and then we have a kyphotic curve, which we see a lot. So like I said, this is on here to reference. It's a lot of words, but the words are just for you to kind of go back and read on your own time. So basically normal versus dysfunctional. So we're looking for functional posture, one that allows pain-free range of motion. We're avoiding, especially in our context, we're avoiding our textbook definitions, because optimal in a baseball population is going to look very different than optimal in, let's say, a football player population, right? So we're identifying our KPIs, we're identifying red flags, persistent pain, our compensatory movement patterns, things like that, but ultimately we're letting our KPIs kind of guide us. So for example, the workouts you see Drew Sample doing are going to be so different than what you see our guys doing. Partly that's because the load that he has to take on, the compression he has to take on is way different than our rotational sport athletes. So the sport demands, they do matter. So, and then understanding how that affects normal. Okay. All right, so we're gonna kind of jump into this. So most of you have seen this. This is our intake information form. We're going to be going over this top half portion today, and then next week we're going to jump into kind of like more range of motion and stuff like that. So first things first, kind of what I wanted to jump into is information intake and kind of how we go about doing that. So first and foremost, you guys have sat in on with a bunch of different coaches, seen how a bunch of us do it, and none of us are one size fits all. We all kind of do things a little bit differently, but we have some key things that we do very similar, and that's finding out our information. So we're asking about background, we're asking about sport, position, teams, current training schedule and frequency. We're kind of gauging information. We're gauging what they need. We're going over, we already review a health history form. We're going over their injury history with them. We're clarifying anything with them. And then we're kind of diving into some of our injury history. So unfortunately, but also fortunately, we're the place where a lot of people come for injuries. So it's really important to kind of take a deep dive on dates, context, asking really good questions. Ryan and I think were you in the eval with Blake Eccles? Have you guys met Blake Eccles? He's a little goofy. So it took us a while to figure out, like, the last thing he said was he was like, oh yeah, you should just go after the car accident. Well, we wouldn't have found that out if we weren't asking questions. So it's important things that seem like major important things to us, but are not necessarily on the forefront for them. So asking really good questions in the eval eval office to try to gauge some of those injury history things. And then also training experience, what they've done previously, kind of giving us some context with a lot of our college guys. We've seen them come in from their college programs. We know what they look like. They're super protracted, they're really down, they're really dense from a lot of these guys. So we're kind of asking, basically what we're doing with this is we're painting a global picture. We're painting a picture for us so that we can start to put the pieces together and start to put the puzzle together of what's happening in the office. And then ultimately we're asking training goals. What did they, obviously while we're in there, we're sitting and thinking, okay, this is what I think. I think they need to gain weight. I think that they need to eat. I think they need to get stronger, faster, whatever the case may be. But we're putting those pieces together, but we're also intaking from them and kind of seeing what they are envisioning for themselves as well. Okay, next thing. All right. Okay, so, and then also talking a little bit about etiquette a little bit. So being present, being attentive, this environment and any environment where you're kind of doing a screening like this is super intimidating. So we want to make them feel the most comfortable, so that way when we do get them on the table, there's not a ton of guarding. Because like we've definitely seen people where they come in and they're super tight just because they're nervous to get on the table. So being present, being attentive, giving them your full attention, eye contact, and all of these are basically a way just to build rapport and build their trust up so that they trust you. Like in this experience, we are the experts. We are the ones guiding and leading them. And most of the time people come here just to be told what to do. So, and that's our job, having confidence in the fact that we can communicate clearly what they need. So that's also part of it. Okay. All right, so we're gonna jump into it. Let's go into, my thing is nice and fuzzy, but that's all right. Where is my, all right, let's jump into static posture here. Okay, cool. So first things first that we look at, and also too, this is more for you to reference back and for us to just kind of chit chat about a little bit. So first thing that we're looking at is static posture posterior, right? So this is kind of a guide and a checklist for you to kind of go through in your head. That's kind of how my brain works. My brain works in lists. So what I do when I look at somebody from behind, these are a couple checklists that I'm going through quickly in my head. So first things first that we're doing. Perfect. Okay, first things first is we're seeing the superior inferior angles of the scap, okay? So what I want to point out, we're going to kind of flip back and forth here so you can kind of see some better pictures. So what I want to note is where these marks are. I kind of liked how they marked where the spine is. I liked where they marked the very top of the scap and then both the bottom angles, just for you to kind of go back and see. But this first part, basically the superior inferior angles of the scap, they should align with the T2 and T7 vertebrae. And I know you're probably like, where the heck is that? So here we go. So T3, T7. When you're looking at the scap, we're looking for generalizations, okay? We're looking for anything that sticks out to us. So obviously, like if we look back here, this person, their scaps are probably super depressed in this state, right? They're super down. He's not a good example of like optimal or perfect, but it is giving you an idea of kind of what we see in the room. So we're looking for any big shifts, winging of the scaps, asymmetries, that's what you're looking for. Next thing you're kind of going through your checklist, we're going through the spine of the scap. So let's kind of gauge over here, and I wanted to give you some context of what that kind of looks like, where the spine of the scap is located, the body, the medial border, which is on the inside, and then the inferior angle. So those are the couple things that you're gonna see and see us reference to. I know a lot of times in the eval room, you're gonna see us palpate those specific areas, and we'll go over kind of here what we're looking for in there. So just so you have reference, medial border, the spine, the inferior angle. Okay, so going back here, the spine of the scap should sit about 30 degrees anterior angle. So it gives us basically just insight to, are we anterior tilted? Are we depressed? It's giving us an idea of what the scap is doing. Are we elevated? We've seen both. We've seen some funky things, but it's just giving us context to what's going on. And then we have the medial border. So on the inside, that should be roughly about 3 inches from the spine. So we're looking for, obviously, if we're super retracted, that space is gonna condense. And then if we're super protracted, that space is going to get bigger. So we're kind of looking for little things like that. And also, we see a lot of times one side is super close, one side is not super close. So we're kind of just doing an intake on what's going on. And then we have the inferior angle. Is it resting flush against the rib cage, or are we winging a little bit? Do they have and this goes to the spine alignment, but do they have any abnormalities of the spine? Do they have any curves? Do they have a flat T-spine? And let's kind of jump into some of those things. So kind of what this looks like, which we've seen with a lot of our guys who are super weak. You see how here he has a super flat T-spine and his scaps are kind of sitting up and out. That is basically just showing some weakness, but it's also showing this is an opportunity for us to give him a little bit more protraction, teach him how to properly move his scaps around his rib cage, and hopefully some of that stuff will kind of clean up. But I thought that this was like a good example of kind of a visual example of kind of what that looks like. And then obviously, as you can see, this guy is retracting here and then he's protracting. His scaps are a little wonky, but this was the best picture I could find for that. So, and then going off of that, this is for you guys to reference back. I know that a lot of us already know some of these things. We know elevation, we know depression, abduction, which is for the midline protraction, upward rotation, and downward rotation. So one of our main goals that we're looking at, and we're going to get into this on this next slide here, but it's super important for our athletes to be able to get up overhead and get upward rotation of their scap. So some of the things that we're looking for in this static posture is we're looking for some of these things that are going to make it harder for them to get up overhead. If they're super depressed, that means that they're already starting at a negative advantage to get their arm up overhead because they're already starting below where they should. Does that make sense? So some of those things, they just are intake form of like, okay, they're super depressed on this side, it's gonna take them a little bit longer to get up overhead. We can do some things to help them. And then the last thing with like the curvature stuff, I kind of just wanted to give an example of some of the weird stuff that we see here. This is someone who has scoliosis and then has some rods in his back, but as you can tell, wonky. Some weird presentations on some things. Obviously you can see that the rods in his back prevent him from getting like this full protraction, but we can kind of see if we can restore a little bit of movement and more just, I think for him, more focus on proper scap movement and controlling what he's doing with his scaps, so that hopefully that can kind of help, because ultimately he's still going to have to throw. He still has to rotate even if he doesn't have it. So if we can give him strength in all the right areas, hopefully that'll prevent him from getting injured. And like right now he feels great. So but yeah, do you guys have any questions on that part of the static posture, just kind of looking from the back? Yeah. It depends, but depressed most of the time. And most of the time, like with a lot of righties too, we're seeing like this. So they're already starting in this like left AIC rotated, depressed position. And it kind of depends. Like that is an open-ended because we see a lot of a lot. Yeah. And we can also see this a lot too. So like I said, it depends. We do see a lot of depression. But I think also that goes to the fact of like, also what do they do as they take their arm up overhead? Because we see a lot of guys get elevation from other places. Or like they will elevate instead of upwardly rotating. So they'll go like this. Their humerus will elevate instead of actually properly having the scap move up and around. Does that make sense? So it's kind of a dependent answer. It's not really a one size fits all. I mean, yeah. Yes, you definitely could. And honestly, we're going to get into this too of like what you're going to see. But you're going to see this. And then you're also looking at like, what is the humerus doing? Are we internally rotated? Because like some guys though, and I'm going to get into what we look at, but they present, it's not like a, and I think this is the most challenging part of this learning process, is understanding that nothing is black and white. It's all gray. And I think that you guys have seen that now in the eval office where we step in and it's like we have an idea of what we think it should be, and then they completely turn it around and they're show and present something different. So I think the biggest thing and the biggest takeaway I do have for you is treat what's in front of you. So look, and it's the same thing with coaching. Coach what's in front of you. Because what we have in our head may not always be what's happening in front of us too. So, and then one thing with this too, I wanted to touch on is, and this kind of goes back to this point of where the elbow sits relative to the torso. In this case, like you can kind of see, especially on his right side, he sits a little bit more like this. His olecranon sits a little bit like this, slightly. His hands are slightly turned in. Those are just things to take note of. And then also looking at muscular density and what is super dense. We had, I think you were there too with Blake, and like the drastic difference between his sides on like his rotator cuff. He had some injury history and stuff going on. But like just intaking some of that abnormality, and also because I've never seen a difference in a room that different, and with his injury history. So kind of noticing like where, and that's why it's important to understand anatomy. So understanding where his infraspinatus is, all the rotator cuff muscles, understanding what they're supposed to look like so you can understand what the dysfunction is. And so same thing with like we've seen QLs that are super dense, we've seen lats that are super dense. If our lats are super dense, that's going to affect how we get up overhead. But big picture, we're comparing left to right. We're asking, we're looking and seeing kind of what jumps out visually. And then with time, this gets better. Like the more you see it, the more you expose yourself to it, the better it gets. It takes a lot of practice. And I think we're all still practicing, like seeing things. And that's why you sometimes see us take videos and you see us like do certain things and look back on it, because there are some weird presentations that it takes a video to slow down and see. So, all right, cool. All right, let's move on to what we're looking at, front view. So this is kind of a checklist that I go through. As you can see here, I think this photo is like inverted. I think he's a righty, but he's super like this. And you can see that by, what are some things that you can see already noticing this? What are some things? Point out. Yeah, his right nipple's lower. What else? Clavicle. Yep, you can see the difference between. Also, what do we notice about like the slight, do you see this like slight rotation? Do you see this slight like this? And that's going back to kind of talking about what Andrew's talking about with the left AIC stuff, and then understanding that it's rotated this way, this is compressed, and this is elevated. So as I'm standing here, it's like this. So that's why you see this presentation of this slightly rotated positioning. But just going through the checklist of, I mean, you were perfectly right. The nipple line, the clavicles, you can see kind of how, even when you see him standing up, you can see the difference of like where his ribs are. That little bit of flare on that left side versus the right side. Where his hips are. But yeah, just going through the whole thing. Is he already standing in a forward head posture? Where his sternum is, does he have a pectus? How is that gonna affect him? fatiguing and those kind of things, where his shoulders and his arms are positioned. His arms are a little bit more internally rotated. What his trunk and his rib cage are doing, and then obviously this doesn't show a good picture of it, but you're also looking pelvis, knees, and the feet. Bless you. I want to go back to this photo really quick. Do you see his feet? See what his feet are doing? That's just something to note in your head. And obviously this is all laid out, so it seems very long-winded, but this is all happening very quickly. The more you do it, the quicker this intake becomes. And then we're looking from the side view. This guy's side view is pretty good, but we're looking at any crazy differences of this, where like this is sitting backwards. What would that indicate? What do you guys think? Yeah, what do you think? He's really rotated forward. It could be sitting like this. Yeah, definitely. It could be. And this is just some stuff for you guys to look back on, but these are things that you're taking as, or circling as we're seeing some different stuff. So we're looking at any rib flare, stuff like that. Again. Also, I added in this little slide for the difference between a flat T-spine and a kyphotic T-spine, because I think sometimes it's hard to understand if you don't have a visual picture in front of you. So I think that this is a really good photo of like super flat and then kyphotic. So that now when you see it, you can kind of understand the difference between the two. So basically going off of that, one thing I want to note too is we've talked about this a little bit in orientation, but we're constantly zooming out and we're zooming back in. So with some of this eval stuff where we're zooming in, we're looking at specific parts. Basically, we're gathering all this info so that we can zoom out and we can see and paint a full picture. So that's why it's important to like have our different angles, move around the room, understand how they move, and that's kind of like why we go through our entire screening, because everything kind of has like a purpose. Everything has a reason behind why we're doing them and how it relates to how they're throwing on the ground. So part of this, and this is what I kind of talked about earlier about our scapulohumeral rhythm, that is what we're working towards. And that is what we're working towards, optimal functioning of our scapulohumeral rhythm, because if we have dysfunction here, they're gonna get their arm overhead and they're gonna throw regardless, which is fine, and a lot of them do awesome without any injuries. But this is, a lot of times what we're seeing is guys come in and have dysfunction with this upward rotation, and then they end up getting hurt because they are still getting their arm overhead, but they're doing it in a way that is ultimately hurting them long term. Whether that's their humerus elevating and banging into the top of their shoulder, are they anterior tilting, are they banging into the front of their shoulder? This is kind of like what we're working towards. So what it is the scapula and humerus in elevation, and then basically we're trying to work towards full pain-free overhead motion and joint stability. So the first 30 degrees of shoulder elevation is humeral movement, and then basically 2 degrees of humeral movement after that is 1 degree of scapular upward rotation. So, and then we're looking for, I think this paints a perfect picture of like this moving up overhead, what 180 looks like. This is 60, this is 120. So what we're watching for are the scapula and the humerus moving together smoothly? Are there delays in movement? We've seen that where like the arm keeps going but the scap doesn't. Is this a soft tissue restriction? Are there any signs of winging, struggling, compensation? And then we're gonna kind of look at these in the next 2 slides, but do they have control over it? As they go up overhead and they come back down, is it nice and smooth? Or is it a little bit jumpy? And what does that mean? And then like I kind of noted on earlier, is like why it matters. It's important because a lot of times it causes dysfunction when it doesn't move correctly, and it causes injuries, impingements, instability, other injuries like that. Like we've seen, even all this summer we've seen a ton of stuff because they can't properly upwardly rotate. So any questions about that? Okay, so let's see if I can play this video. Okay, so let's jump into shoulder flexion. All right, what are some things before we start reading this slide, before we start going through everything? What are some things that you've seen so far in the room on shoulder flexion that you've seen some notes about or that you've already talked about? What are some things that you know already? Go ahead. Yeah, they start traps first and then they go like this. Yep. What else have you seen? Yeah, it's true. What else? Yep. What else? Yeah, he said, can everybody hear what he said? Speak up a bit.
They try to get an extra range of motion without arching the back.
Yeah, they go extension first as they get up overhead. What do we notice about their arms at the top? Have you guys noticed anything? Yeah, maybe the distance, sure. Okay, so what all of that means. So as they go up overhead, let's look at this guy. Cool. I wish this played on a loop, but I don't know how to get it to do that. Let's go over all of it and then we can kind of talk about what we see with him. So do the arms finish in line or past the ears? So do they come all the way up overhead or do they stop right here? Is there bowing in the arms? What do you think that means if there's bowing in the arms? Tight lats. They can't fully get up overhead. There's some bowing. Also, is one arm higher than the other? There's sometimes guys that come in that like their arms look like this or like this, just depending on density and things like that, muscular density or other injury issues. Let's go. Scapular mechanics. We're looking at, as we go up overhead, we're looking for a smooth upward rotation, no shrugging or retraction, kind of like what he said. And then you guys can kind of reference back to some of these other things. But when we look at them, like, are we visibly seeing, are they going up overhead? Are they doing this? And we're going to be able to see them from the front view too. But are we getting a rib flare? Are we extending? All that sorts of stuff. And then global, kind of what we're looking at is, can we achieve these full range of motions without compensations? And then is it pain free? And then how limited is it? And kind of looking at asymmetries from side to side. Questions about that before we look at this guy? All right, so let's kind of take a look. What are some things that we noticed? I'm just gonna go ahead, shout it out. Yeah, definitely. What else? I know y'all got something else. Let's, at the top, maybe a little bit. Let's see. A little bit at the top. What else? He is really reaching. I think part of that too is understanding, and like I said, this video is, well, the only video I found on my freaking phone. But part of this is like him kind of understanding also like what to do. He's been here before. But yeah, he does really reach forward, but that's also important to note because all these things that he's going to show us on here are things that he's going to do over there at a higher speed. So like, this is interesting to take note of. Like, he really reaches forward. Is that because he's been here before? I don't know. But he extends at the top. He doesn't really have, he has like some lat density. His arms are internally rotated. What else do we have? Yeah, you can see the difference between the two. And he's a right-handed thrower. You can kind of see like the limitation in there. And then on the way back down, what do you notice? Let's go back. Let's play it again. Yeah. Also, do you see this as he goes up? Okay, as he comes back down, do you notice how quickly his scaps like kind of jump? That's lack of control on the way down. So as he goes back up and he comes back down, he doesn't have much control on the way down. Look at this little jumpy part. Goes up and then back down. See that little jump at the end? That is the lack of control and strength.
Should that be something where programming like a lap down?
I mean, I think we have to have more context on like what's going on and like what his numbers are. But like for someone that looks like him, I'm probably not worried about a lat pull down because he's already so internally rotated. And that's why it's important to understand where anatomy is, because the lat attaches on the humerus. So he's already, one of his bigger muscles is already taking him into IR here. So we want to think, and we don't want to retract him, but we do want to get his cuff strong, and we want to put him in positions to actually posteriorly tilt and move his scap around his rib cage. He probably is a good candidate for like some serratus stuff, some upward rotation stuff to help him understand how to do that without like elevating at the top. And we're gonna see his shoulder abduction next too. But that's why programming, we do program a lot of like lat pull downs and stuff like that, but there are certain populations and certain guys where we kind of taper off on the lat pull downs only because they're like this already. So maybe there's a time and a place for it, but all right, let's move to the next one. Do you guys have any questions about this? We're gonna do some examples. We're gonna have some of you guys hop up here and we're gonna kind of take a look and see what we see at the end too, if we have time. I don't know if we're gonna. Okay, let's play this. All right, what are some things? Pinching. What else? Right side is a little lower than his left. What about on the way down? He goes back to the middle, which obviously takes more time, and like this is part of why it's important, and this is also why like some of the when the pitching guys sit in, you'll see them kind of intaking on this static posture thing because they can see some of this stuff and help them understand why they're doing what they're doing on the mound, because it takes them so much longer if they go this to go back up. It takes so much more time to do that rather than like you'll see guys who like pinch down and back, guys who are super like lat heavy, which you guys pitching side would know a lot more than I would on that. But those are kind of some of the things that we see. What else do you see? Yeah, he pinches on the way back. He's still like kind of living in this like extended posture here. You can even see it from the back. I don't have a good side view picture of him specifically. Yeah. No, I think you're right. I think if I recall, I haven't seen this kid in a while. But, and you can also see too, like the weakness here. And you can see how dominant his upper traps are. You can even see as he goes up overhead, like, look at his upper traps versus as he comes back down, like see how there's like no density in here. So he's like a really good candidate for some like supine, low trap raises to teach him actually how to like posteriorly tilt his scap and get into a good position there. Kind of take him out of like this. A good candidate for not having pull downs and stuff in his program. So questions on this? Anything else we want to note? What do I see? My first thing that I see is, number one, from this video, what I would test is see if he's hypermobile. Because the way that he takes his arms up overhead, he has some restriction, but he looks very Gumby. So like when I'm looking at him, he just like looks like he just moves all over the place and he has no control. So this is probably a guy who's been training and like he has a lot of like upper trap density, but like he probably has not trained properly, and I bet a program from us would kick his butt. So, and this is why it's like paying a pitcher. This is one part of the pitcher, but like what goes through my head when I see him is I'm looking at his hip height, I'm looking that he's extended, I'm looking that he's here. Maybe how fast he does it, but part of it also too is not necessarily how fast I'm looking at. I'm more looking at like he's not, he's like fully just like up and then back down. So maybe not how fast it is, but the way that he's doing it is giving very loose. Does that make sense? Oops, come back. Also, if you look here too, like, he probably could benefit from like losing probably a couple lbs. But I think when I think about him and when I look at him, I think he needs some really good arm care, and I think he needs some really good basic strength. It's from this picture. Now, obviously, I don't remember his injury history or what he has going on, but all of that piece of pictures are like why he's doing what he's doing. So like that's why it's important of like, we see these little clips and we're looking at certain things. We're kind of looking how his right is like lower on this side. We're doing all those things, but also painting the picture of like, we already at this point know what his injury history is. So in our head, we're already going to like all these different ideas of like what's going on because we know his context and we know his background. That's why it's important to like ask the good questions up front. And then that way when you get to this point, you know what to like look for. You know to be like, okay, he has elbow pain and discomfort. I'm gonna really like zone in, and you can see here he had TJ. But like, why did he have TJ? Did he have TJ because he's like this? Did he have TJ because he's like this? Because he can't get his arm in like the right slot? Because obviously like he's a good candidate for some like horizontal abductions to get himself like moving correctly, because I bet you what he does is this. So that's kind of like where my head goes on him, and just in this without the context of like injury history. Yeah. What I would do is I would have them do it exactly. You just tell them what to do and they do it exactly how they're going to do it, because that gives you context to how they are. I'll give you an example about, we have a guy in the gym right now who does things that he's supposed to do slow, fast, and things he's supposed to do fast, slow. So he's ripping a hip airplane like this. Like, never seen that in my life. So that gives you context to like who he is as a person and what he's also going to be like on the mountain. Because I can assure you he had an injury, and I can assure you he was out there ripping stuff, not knowing what he was doing, throwing plyos, doing all sorts of stuff at 100 miles per hour. But that gives you context of like who they are as a person, so that you can coach them better later. So like my suggestion would be, take the video, and I always ask them first. I'm always like, are you comfortable with me taking the video? And then they say yes or no. We take the video, and then that way you can look back and you can kind of look at it on your own time and break it down. So then that way you can start to train your eye on what to see. But I do think it hinders it, because I think that like I just said, the way that he did that, like if I just did that and mine looked nothing like his, because I'm tight and I move like a block, unfortunately. But so that's kind of cueing it. And you've kind of seen in the room, like, you just tell them, like, hands in front, go right up overhead, and then back down, because we want to see what they naturally do. But that's a really good question. I think that that's a good point. Any other questions on those, too? I don't think so. If I had to guess, he probably still has full range. I don't know though off the top of my head, but like it very well could, and that's why it's important to also, we're taking hypermobility, we're doing a test to make sure that we understand, are they hypermobile, what is their baseline. That's why we take both arms, what's baseline on both sides, so that we can kind of see the difference. But even here you can see he's like rotated a little bit weird, so it's just things to know on what's going on. So, anything else on here? Okay. All right, so shoulder external rotation you've seen in the room where we have them stand. What do you think that we're looking for here? Are they actually using their rotator cuff? What are some things that we've seen? Yeah, they're super trappy. What's another really big one that we see? Rib flare, which often is with what? Retraction. And that's what we see a lot, is here. And this, I put this in because I think that this is a good example of how these muscles are kind of overlapping each other and kind of how they look and how it's easy to, seeing this view, it's easy to understand how these guys can use their bigger muscles for externally rotating versus their, infraspinatus. Like look at these bigger muscles versus these little ones under here. And that's why we see a lot of the time when we do arm care with them, and arm care has been so much better, by the way. So yay. Using here versus here. So, and I thought that this is like a really good picture of like kind of how that all kind of ties in. But what we're looking at, yes, we're looking for retraction. We're looking to see if they do that, if they elevate. We're looking at arm position. And this can you guys can kind of take a look at this a little bit later and kind of look through this on your own. But we're also looking for like, are there any like crazy densities or asymmetries from side to side? Are we seeing any like huge differences in the rhomboids and the QLs, stuff like that? But yeah, global picture. Is it controlled? Is it pain-free? Can they do it over and over again? And that's part of the problem too with the elevation. Can they repeat that and do that over and over again? And if they don't have control getting their arm up overhead and coming back down every single time, they're going to do it different every single time. And that's where you see these guys out here on the mound where like they go out there and they throw, but they can't find the feel they can't repeat it. And part of that is strength. And part of that is like doing proper arm care in the gym so that they can actually feel what it feels like to have their scap come up and around their rib cage so that they can repeat it over and over again. Yeah. All right, next. All right, let's talk about toe touch. All right, what are some things on the toe touch that we've seen? Why do we do the toe touch? See if they know how to hinge. What else? Weight shifts. What else? What else does that tell us? How what?
How comfortable they are.
Sure. Yep. Do their knees lock out? Do they just bend straight over? For sure. So this is going through my little checklist here of like what we're looking for. So do they hinge or do they fall over? Do they have a weight shift? What are they doing with their knee? What does it tell us if they bend over and their right knee comes forward? What do you think? Bend over. This one, it's this pattern. Because we run out of room. Because we're already stuck back in this hip. So as we go forward, this hip can keep going because we have room, but this one has no more room. So we bend our knee and it appears like it comes forward. Does that make sense? So we're stuck into this hip, and that's why we do all of our stuff. I know you talked a little bit today with Ian, but that's why we do a ton of our hip shifts into our left side so that we can get a little bit more IR into this hip and bring us back to neutral. So that's why you see that right knee go forward as you go down, because you just run out of room in the hip. Do they have a rib hump? What does the rib hump mean? Right rib hump, what does that mean? Say it again. Yes, but why? Why are they presenting like that? What do we think? Has to do with something we already know, we've talked about. Maybe core. But also in this context, it's this. Like if their rib cage is already shifted back this way, they're gonna present like that. posteriorly. So they're gonna have a right rib hump because they're shifted this way and this is flared. So as they go, which ultimately would be core contraction because this is so compressed. So this is compressed, this is elevated, and that's why you see this rotation towards that right side and you see a right rib hump. Feet position, do they externally rotate? We saw that in our slide earlier. Knee behavior we talked about. But is the movement controlled? Is it asymmetrical? Are they bending over? Are they hypermobile? All of those things. And then these are some videos to take a look at. Let's look at this one first and kind of tell me what you think. What do you think? Yeah, knees kind of walk out. What else? She is shifting back. I think she's just bending straight over. Watch how she locks her legs out and then she just brings her torso down rather than actually hinging. Do you see it now or do you? Yeah. See how that little, it's like right here. Her butt goes back a little bit, but it's because she locked her legs out and then she has the mobility to just bend over rather than actually hinge. What else do we see here? We can note she's like a little bit kyphotic in her thoracic spine. She's probably hypermobile. So she would be someone who's a good candidate for like teaching how to hinge. A little bit of bend in the knees. Anything else we see before we move on from her? You can't really tell from this angle, but her feet go out a little bit as well. So, all right, let's talk about this man. And this man is, we're gonna briefly talk about him because he has some structural limitations. But what do you notice? What are, huh? He shifts that way. What else? Left. He does. He has like this little bit of right, but do you see how that's also? I think it's also important to note though that this is just, I want to show you some different presentations, but he's presenting in this way because he has some actual surgical adaptations. He's surgically, like, there's not much that we're gonna do to change a rib hump in this situation, given the fact that, you know, he has some rods in his back. It could be, but you definitely, the people who are super lax and who are hypermobile, almost always they just drop because they can't. And then obviously he's more restricted, but that's also, he's restricted, like he feels tight, but also it's because he has no more room to go. Because wherever his femur is, or wherever his pelvis is, like he is there, like structurally. I don't know if there's much change that we're gonna be able to do. Like there's no tucking or whatever, like. And I think we can definitely work on his scap stuff and give him a little bit more movement, like protracting, and I think that would make him feel good, but it's kind of one of those things where we have to retest to see how he feels. But what else on this toe touch? Anything? And then as you're sitting through we have one more thing to go over and then we'll be done. But as you're going through your evals with your coaches now, like, and this goes back to the point we talked about. I don't know if everybody was there yesterday, but try to limit yourself from asking things in front of the athletes. So like, for example, if we're doing a specific exercise, maybe ask how to execute it, but ask the why later. So that you can understand it later, not in front of the athlete. But this is something like, if the coach is not busy later and you have certain questions from coming out, write them down in your little book, write them down in whatever, and then ask later. And you're like, hey, he presented like this, I noticed this, what did you think about it? What did you think while you were doing this when you have time? And then that's how you learn. And that's how you kind of like pick up on different things that, just because I look at it this way, someone looks at it different. Andrew definitely looks at things so much quicker. He's picking up different things, like pick people's brains on like what they see. We're gonna go over our last thing, which is our next screening. And this is a table to reference, but do we all know what the FN and DN stand for? What is it? Functional, non-painful. What are the other ones? Yeah, so basically functional, non-functional, and then painful and non-painful. And then basically what we're looking for here, this kind of breaks it down, but we're looking for full range of motion. So we're basically looking for their chin to get all the way over to their shoulder without any compensations. What are some compensations that we see? Their neck goes forward and then out. What else? Trap, maybe some like shoulder movement where they're like trying to like move their shoulders as well. And then also just asking about discomfort. And then we also have chin to chest. No compensations. We're also looking for any like weird rib humps or any cervical humps or anything like that. Do they have full range of motion? Is it painful? Is it non-painful? All things we're kind of asking them. And then extension, eyes to the ceiling. And then we're also looking, is their mouth opening at the very top, because that would be considered dysfunction. Is it painful? Stuff like that. But this is all kind of like stuff to look at. Any asymmetries inside. We're just kind of, this is also super important because if they can't look this way, and obviously they can rotate a little bit while they're on the mound, but it is important to understand how that influences how they throw and how they get their arm back. I was just watching, forget who I was watching, but this guy was throwing with like his entire neck. And I was like, that is a neck injury waiting to happen, because his first movement was here versus getting his arm back. So those are just some things to like look at and to understand kind of how they impact how they throw. But this is the baseline. This is how you move. What else? What other questions do we have? That's all I have on those top couple. This is my first, truthfully, this is my first case with someone who has scoliosis that severe that they had to get rods in their back. So I'm also learning during the process, but they are going to be restricted no matter what. But we still can get him strong. He is severely underweight. He also, the functioning of his scaps, like, he's not strong. He's not strong, and some of those functions are not working as optimally as they could. So we definitely have room to grow. It's not like it's hopeless. Also, he's still throwing at like the elite level. So like his spine is still taking the impact. So I don't know what I didn't get a chance to sit on the pitching meeting, so I don't know how hard he throws. But like we still have room to give him a little space and to get him stronger, which ultimately will make him feel better. So but that's like one of those things that's like a test. We're kind of treating him like he's a compressed narrow, where we're trying to give him space this way, front and back, A and B. And we're trying to give him a little bit more rotation and have control over whatever end range of rotation he does have. So he gets his arm up overhead and he throws. So he can do it. What else? Nothing. One last thing I kind of want to talk about too is all of this is super important, but understand that as humans, we compensate. That's what we do. And it's not necessarily always a bad thing. Like for him in that case, like he's going to get his arm up overhead and he's going to throw. And there's going to be people who are super successful at throwing because they just make it happen. But there are some ways where we can kind of change and make a huge impact on out here because of what we do in there. Like we have guys, I'm thinking of someone in particular, I don't know if he's out here, I don't know his name. but he has a problem with like sitting and lead leg blocking. Those are things we can work with in the gym. If we get him a little bit more IR here, if we teach him how to actually pull his hip back, all of that makes an impact. But going off of kind of what Austin said, it's like they still have to teach these guys how to throw, however they show up out here. So our job in the gym is to put them in the best possible position so that they can come out here and they can throw, and these guys can make them do what they want them to do. And that's kind of how we work together. You have something? No. Yeah. We don't do different. But I also think there is a play to do it different, and I like that. We see the vast majority of pitchers. So, and some of the things we do see with the hitting guys is like we more focus on, I think Andrew kind of talked about this with like that and stuff, but like we're looking at major differences on like hip and shoulder and things like that. Are they sitting back? Are they not sitting back? The force plate numbers, is there a difference between those? And that's kind of more what we're looking at right now rather than, yeah. And we're looking at like, are there drastic asymmetries in their force plate jumps? Like how can we kind of manage it that way? But we don't do anything specific different in the eval process. More the functional testing and also like volume, what are they doing? Because a lot of times when we get these catchers, they are catching for us and they catch a lot. So like, how is the volume impacting more than it is necessarily not? So, because like, these guys are, the demand on them is so much more, especially when you're having a catch up. So, but yeah, that's a really great question. I think that there's a play to do something different. I don't know if we like logistically right now have the capacity to do it, but also to like we don't necessarily see as many. What else? I think. Go ahead. What about it? Well, I'm painting a picture of like what they look like. I'm painting a picture of like, are they compressed here? Like, what's their intersternal angle? Obviously on the table, we'll get to that. Are they compressed here and then they're flaring? Like, what does that mean? What are we just flaring like this because we don't have control of the core? Are we sway back? Are our hips underneath, or are we extended like this? So those are a couple different like postural things that I'm like looking at when they go to Ric Flair. Part of it too is like density. Are they so tight that they just can't get their arms overhead without having to Ric Flair? That's a lot of it too. It's just like they just can't get their arm up overhead without doing it. Those are my first thoughts. Anything else? Are we good? Let's start with that. Break. That's it for today. Will you guys help me take some of this stuff in? Yes, please.
Dude, do you want us to take apart the projector when we get back inside?
The bag is on the chair by the PT.
That box is the kitchen.
This box can go over with the kitchen guys. That box can go inside. It's fine.